My name is Francisco Quinteros. I'm a colorectal surgeon and also a general surgeon. My specialty training is in colorectal surgery, so it's a lot of things, including all the things that no one likes to talk about, like fecal incontinence, and basically just pain in the rear end, from hemorrhoids and fissures and complex fistulas and infections, to then more life-threatening things like colon cancer, rectal cancer, anal cancer. We treat all of those. Functional issues like people with severe constipation, diverticular disease, that they've had multiple diverticulitis infections, and even colonoscopies. So anything related to the colon and large bowel is something that we treat. And finally, the kind of more nebulous topic is Crohn's disease and ulcerative colitis, those inflammatory bowel diseases. We work with the gastroenterologist to step in when surgical intervention is needed, when medication is not enough to control the disease. For the cases that I use the robot, I believe it makes me faster and more dexterous. I consider myself to be pretty skilled at laparoscopy, but there are certain things that are very delicate, and I think the robot gives you that extra degree of flexibility and precision in your movements, particularly in my case as a colorectal surgeon, in the pelvis, in the deep pelvis. It's a very dangerous and difficult area to work in, and the robot gives you a better visualization and just gives you that extra bit of control of your motions that can be hard with laparoscopic instruments. I use the robot primarily for rectal dissection. So that would be something that if you had a rectal cancer, I would do that pelvic portion of the procedure using robot assistance, and anything else related to the pelvis. My practice philosophy is that I'd like to combine recent evidence and data with technical excellence, but in a way that still seems compassionate. I think the knock on surgeons is that we're very detail-oriented and very procedure-oriented, but it takes a lot of trust for someone to come see you in their office and decide to let you remove even a mole on them, much less a cancer that your surgery is going to impact directly the success of their treatment. So yeah, you have to make that connection with people, and I try to communicate that with them when I meet them. One thing that I like my patients to know about the way I conduct surgery, and I reinforce this with them in the office and right before surgery when I see them in the preoperative area, is that I really am going to do for them what I would want done for myself or a family member.